The region has more than 25,000 confirmed cases of COVID-19, with more than 1,200 deaths, and governments are working with partners such as the World Health Organization in tackling the pandemic. WHO Regional Director for Africa, Dr. Mashidiso Moeti, called on all countries to ensure that essential malaria prevention work continues.
We are very aware of the potential impact on malaria if certain actions are not taken. And what I can emphasize is that we need to make sure that the malaria interventions, the key malaria interventions, are carried on in ways that are adjusted to the situation of the physical distancing enforced by the COVID-19 outbreak. But we would like to have continuation of the distribution of insecticide-treated bed nets. People, including campaigns where this might be possible and where it's necessary, people must continue to be treated for malaria, either in health facilities with physical distancing being maintained or in outreach ways. And healthcare workers need to be provided with personal protective equipment if they feel confident and are able to provide care and treatment to people, both for prevention in terms of distribution of the key items. And that depends on the decisions of governments to open up in terms of some of the flights that can be mobilized by the international community to make sure that these supplies are there. So if we do not see this happen, if we see a dropping off of prevention interventions like campaigns and net distribution, we risk, as I said at the beginning, to have a return to twice the level of mortality from malaria as we had in 2018.
She pointed to statistics from Africa's Ebola outbreak showing that more people died of other diseases, including malaria, than from Ebola itself due to lack of access to treatment.
A recent analysis has found that if insecticide-treated bed net distribution stops and case management reduces, malaria deaths in Sub-Saharan Africa could double in comparison to 2018. This would be the highest number of deaths seen in the region since the year 2000. So I urge and encourage all countries to maintain malaria interventions in line with WHO recommendations to ensure that health workers and communities are protected. We saw with the Ebola virus disease outbreak in West Africa that we actually lost more people to diseases that we previously were managing to control, like malaria, than we lost to the outbreak itself. Let us not repeat that again with COVID-19.
In 2018, there were 213 million malaria cases and 360,000 related deaths in the Africa region, accounting for over 90% of the global cases. The World Health Organization said that if the focus on slowing the spread of the new coronavirus leads to a reduction by 3/4 of access to anti-malaria medicines, deaths could double to 769,000. The doubling of the number of deaths represents the worst-case scenario, which also assumes the suspension of all distribution of treated mosquito nets due to the pandemic. Benin, the Democratic Republic of Congo, Sierra Leone, and Chad have all initiated anti-malaria programs during the pandemic, the WHO said, adding that this should serve as a model for other nations on the continent.